Hi, this is Dr. Sarah Wilde with Angela Physical Therapy and Wellness. I wanted to come to you today to talk to you a little bit about the pelvic floor. So, what are the functions of the pelvic floor muscles? Hopefully, you've heard of them before because they're very important. Uh, the first function of the pelvic floor is to stop the flow of urine. It also, on the other hand, can let go or relax to initiate the flow of urine. Both of those things are important. The muscles can also aid in the passing of stool and also aid in sexual function. Okay, so I wanted to show you a model of our pelvis. Okay, anything you see that is this white and hard surface, that's a bone. Okay, so we have bones in the front part of our pelvis. We have these big bones on the sides. And then the back part of our pelvis, or what I like to call a pelvic bowl, is going to be our spine. Okay, you can see inside the pelvis here, it's hollow. It's a bowl. Okay, that's why I like to call it the pelvic bowl. Okay, so anything that you see that is red is going to be muscle. Okay, so the muscles that you see here are part of what we call the pelvic floor muscles. They all come together to make up the pelvic floor muscles. Okay, so we have this superficial layer, or the layer that's on the outside. Okay, this is where our urine comes out. This is our vaginal opening, and this is our rectum. Okay, all surrounded by muscles. We can pop this thing off just on the model, not on us. And you can see there is a deeper layer. Okay, you can see that layer from inside. So both of those layers make up the pelvic floor muscles. Okay, let's plop this back on. All right, so you're probably watching this because you're having some sort of issue, whether that is bladder pain, pelvic pain, some sort of bladder problem with urine leaking, maybe some fecal leaking, fecal smearing, that kind of thing. So I want to just give you a few tips on some super easy things that you can try and implement today that will make your pelvic floor muscles happier. The first thing, and this is going to go for almost every patient that I see, is sleep. Sleep is so important. Sleep calms our nervous system. Our bladder, which I have right here that sits inside the pelvis here, is a smooth muscle. And all that means is that we don't have control of the bladder itself. Now we have control of the muscles that close off the neck of the bladder down here. Those are our pelvic floor muscles, but we don't actually have control of this bladder. We don't have control of when it's going to give us the urge to urinate. Okay? But since it is a smooth muscle and it's not voluntary, one of the ways that we can calm it down or tell it to kind of be quiet, stop telling me I have to go to the bathroom, is by sleep. So I want to encourage you to get a good 7 to 9 hours of sleep per night. Okay, and it needs to be quality sleep. And there's tons of ways that we can improve the quality of sleep. And we can definitely talk about that more in a one-on-one session if you would like to. But sleep, that's a great tool, something that you can implement today. The second one is exercise. Once again, we think about the bladder and the fact that it is an involuntary muscle. We don't have control over it. And then once again, we want to calm our nervous system. Our nervous system is what controls our bladder. We want to calm it down so that we can tell the bladder to be quiet or to calm down and don't tell me I have to go to the bathroom all day. Exercise is another thing that can calm the bladder. The next thing that can calm the bladder is deep breathing. Once again, deep breathing is going to be diaphragmatic breathing, not chest breathing. So the type of breathing where your belly punches out and comes back in. Okay, that really deep breathing will bring your heart rate down, bring your blood pressure down, and as a result, calm the bladder. So all of these things are going to be calming things. Also, anything that you do that is relaxing to you, maybe breathing techniques, meditation, yoga, anything like that calms you down will also calm your bladder down. And the last thing is water. I want you to make sure that you're drinking enough water. Now, what is enough water? That's sort of up for debate, and I don't know that anyone really has the right answer. But when you go to the bathroom, you want your urine to be a very light yellow. If you're noticing that it's super deep yellow and sort of orange, you're not drinking enough water, okay? So, take an inventory, see what you're drinking now, and take a look at your urine, and you might need to increase your water some. Okay, so those are the I guess 5 quick ways or 5 quick things that you can do today that will start to help your pelvic floor and calm your bladder down so that you're not having so many urinary symptoms. Okay, in the next video, we'll get into some specific problems and what some quick fixes are for those. But as far as your pelvic floor, your bladder, your pelvic floor muscles, those 5 things are gonna ring true for all of the things that we'll talk about next. Okay, so sleep, exercise, deep breathing, relaxation / meditation / yoga, and then making sure you're drinking enough water. So I'd encourage you to try all of those things. Give it a couple of days, and then we'll implement some other stuff. So if you have questions, please send me an email. I'll have my email in the comments of this. Please reach out. I'd love to answer any questions. I'd love to schedule an online consultation. And if you're local to our little town in San Angelo, Texas, I'd like to welcome you in for a free, just a total body diagnostic, like a free chat about what's going on. And I'd love to tell you the ways that I can help you get back to living life the way that you want to live. So I hope y'all have a great day, and please let me know if you have any questions.